মেশিনে আস্তে আস্তে করে যায় কিনা। কোন চোখ হবে? বাঁ চোখ। So we're going to start Phaco, which is hard cataract, grade 4 NS. We're doing draping at this moment. Our plan is to do submarine job. Patient is boyos koto?
78.
Patient is a 78-year-old male. আপনি কি কোনো ওষুধ খান কোনো কারণে? আর কোনো ওষুধ? পেচ্ছাবের জন্য কোনো ওষুধ? The patient is on medicine for hypertension, no other medicine. People has dilated, mid-dilated people. So let us see if we can complete this surgery without using any pupil expansion device or not. Size of this pupil is about 6 millimeter at this moment. Sometimes during direct job, the pupil shuts down and pupil size becomes small. So this is the main incision, the 2.8 millimeter keratom at mid-limbus. One point three is magnification. This is the side port on the left side. We're going to plan to manage with only one side port. This is trypan blue dye. Dye is applied over the anterior capsule, and this is adrenaline. The pupil size is smaller now. I'm washing the dye out. No, pupil size is okay. The pupil has dilated little, maybe 1 millimeter more. And if this dilatation remains throughout surgery, there should not be any problem. So this is the rhexis with middle of the. See, if I press it, there is wrinkling of the anterior capsule, and I am not able to pierce the capsule. Let us see, try. Yes, I have been able to pierce the capsule. And now plan to do as large a rhexis as possible. Go along the pupillary border and do a rhexis of about 5.5 or 6 millimeter size. Now this is the hydrodissection at multiple points, and small amounts of fluid injected, nucleus is tapped. There should not be any fluid build-up, and the posterior capsule should not rupture by hydro in such cases, because a hard nucleus drop becomes a huge job for retina surgeons. And now we have to divide this nucleus the exposed part of the tip is okay, but since the cataract is hard, I am exposing it a little more. Removing some superficial cortex. Now I rotate the handpiece And now submarine chop means you have to go inside the lens matter, push the nucleus little down, with full energy go vertically into the lens matter. And now stop here, support this part of the lens and go horizontally for some distance. And now this is the crack, and here it is. The nucleus has cracked nicely, rotated 180 degree and separate the two heminuclei completely. And now this heminucleus is divided. Similar technique, go inside the lens mass, crack occurs along the track. This one piece has been divided into two smaller pieces. This is the other piece. It is also divided into two smaller pieces. This is the other heminucleus. So there is a joining between these two pieces. Let us start emulsification now. Ultrasonic energy from the beginning is what percent is it? Energy. 80% total. I'm going to use 80% ultrasound now and emulsify these pieces. Always hold the pieces, draw at the central part and emulsify. And some more pieces should be down to protect the piece. Focus ঠিক আছে? পরিষ্কার দেখা যাচ্ছে, কর্নিয়াতে একটু জল দিয়ে দাও। So this is tilted. Place a burst of ultrasound here and the pieces become free. Focus না থাকলে বলুন। Now I am reducing the vacuum, 350 vacuum now. Ultrasound কত power আছে দেখো? 60% ultrasound, it's okay. Lens matter is not very hard now. Nucleus sclerosis was about grade 4 in this case. So we have managed the nucleus. Now there are some nuclear pieces here. You can remove that through this main port. It will be good. So bring it here. One piece comes out. This is another piece. Let us see if we can bring it out through with the Simcoe. One piece. This is the piece. Yes, it has come out. So the nuclear pieces, the bits and pieces of nucleus has come out. And this is the cortex. Go through the side port and remove the cortex from this side. And we are ready to implant the lens. Board cartridge. This is a B cartridge, so going to enlarge the main wound little bit, just on cut. And here it is. The lens goes in the capsular bag. This is hydroimplantation. There is no visco in the anterior chamber. There is no visco in the bag. Some visco is sticking to the corneal endothelium. We're going to remove that during the last wash. This is a moxie. We apply some. This is hydration of stroma to close the side port. And now, this is how we remove the visco from the, just this aspirating port will direct some fluid upward towards the endothelium and it gets dislodged and removed. So all the visco from the corneal endothelium removed, all the visco from capsular bag removed, and patient is going to have a very quiet chamber, normal intraocular pressure, and very comfortable postoperative period. So we are done. We have to check the bones. We have to check the IOP digitally. It is fine. Few drops of moxie has been applied over the cornea. The speculum is removed and the case is concluded. Thank you very much for your attention.
Like